Okay, we are in our first performance school of May. We're excited to have Dr. Nicole DeFerrari join us, lead our conversation today. Thank you, Nicole. Thank everybody for being here today. You guys that are always here with us, thank you so much. Looking forward to what we have today. So a couple reminders. We are recording this just as always. So just kind of, we'll keep everything from comments and topics within something that we can share in a professional lens. But if there was ever something that we get into, we can certainly edit it out or choose not to share this. We do post this on YouTube so we can share it with other people around the athletic community and university community. So we'll keep that in mind. Just some other things at this time of year, everybody's schedule is a little bit different. So just encourage everybody to maximize your personal and professional health of yourself as well as your staffs. As we move into the summer as well, from a performance standpoint, it's always kind of good to push some sort of evaluation with your staff. It could be just encouraging conversation. It could be a formal end of block evaluation of positives, negatives, things to continue to study, but that's going to allow you to take records and also to move things forward. Also a great opportunity with the downtime to potentially think ahead, what's coming ahead in the next 12, 24, even as far as 48 months ahead for your athletes that are entering your program, and then start to really dig in within all your different departments, how that, those different departments can interplay within that big system that is your sport or program. Also a great opportunity for some research and development. What are some topics that you typically do not have time for as a staff or individually within a season or an off season? This could be an opportunity to develop a new skill set, develop a new repertoire of ideas to talk about with your program. And then also, Carl mentioned this on the head coach call earlier today, great opportunity to engage with your performance team to set up interactions and different things that they can have with your team throughout the next year. And would encourage everybody to get on that early if possible, just so we can all have a consistent schedule. And as I mentioned a minute ago, we are recording all of these just for historical reference and also to share with people that may be unable to attend. They are located on YouTube. Again, this is what we're trying to create here is just a professional learning community. Are trying to root it in some common tenets of what's called a community of practice, with a shared domain community and then shared common practices. There are some neat reads here that we put on here just so everybody can see. These are just some examples, a lot of times from the business world, but a lot of it is very applicable to what we're doing within the systems that we have within college athletics. This is what we've done so far this semester. We are super fortunate to have Dr. DeFerrari from CAPS join us today. We have one more following this. In 2 weeks, we'll have Mitch Gerber from Creative Services talk about branding yourself as a professional, interviewing, and more importantly, communicating to a large audience. So I think a little bit different for us than what we typically do as far as operations as it pertains to working with athletes, but I think that's going to be really good. So with that being said, I will stop my share and I will pass it over to Dr. Nicole DeFerrari. Nicole, thank you so much for leading this conversation today, and you have the floor. Thank you, ma'am.
Of course. Thanks, Nelly. Thanks for having me. I'm super glad to be here with you guys this morning. And looking through the screen, I think I've met some of you as the year has gone on, so it's super good to see you again. And for those of you, if this is the first time that we're meeting, it's so good to meet you. My name is Nicole, and I'm the intercollegiate athletic psychologist. I'm housed over at CAPS. My primary role is to work with our athletes who are dealing with any sort of mental health concern, whether it relates to their sport or not. And another part is to coordinate with y'all over individual cases. And today I am really excited because I really appreciate what Nelly was talking about earlier in sort of shared competency. We're going to be talking about a topic called the individual zone of optimal functioning from a psychological lens. My hope is that this will be an interactive and collaborative conversation. So if at any point you're like, hey, I have a question about this, or I have a thought, feel free to pause me and we can address it in the moment, or if there's something you'd like to say for the end, we're more than welcome to do that too. And I have a little bit of an unorthodox question. Do folks have their cell phones with them? Okay, if you don't, grab it. We're gonna need it in just a second here for a quick poll that we're gonna do. But let me go ahead and get started sharing the PowerPoint. Okay, you guys are not seeing this yet, correct? Okay. Okay, are you seeing the PowerPoint now?
Yes.
Awesome, thanks y'all. Okay, so like I said, we're gonna be going over the individual zone of optimal functioning from a psychological lens, and hopefully there are some tips and tricks that you'll be able to take away from this that you can use with your athletes, or you might recognize some of the tips and tricks within here that you might already have implemented with them. So our goals for today, we're gonna do a quick warm-up activity, which is what you're gonna need your cell phone for. Then we'll dig into defining what eyes-off is. We'll talk about the impact of the stress diathesis and mental health and how it relates to eyes-off. And then we'll dive in more to the practical implications, which include the tips and the tricks. So here's our mental warm-up. If y'all wouldn't mind putting in this URL into your web browser, it's gonna take you to a poll. And I will, let me see if I can, I don't know if I can put it in the chat, but does everybody see that URL? All right, cool. What I would like you to think of is, can you remember a time where you set a PR for yourself, whether it was something related to sport, to academics, to the arts, to music, or a performance that just stands out as one you'll never forget, a favorite performance? I would like you to think to yourself, what emotions were present? That poll is gonna enable you to input 3 emotions. It is anonymous, so it will not record what you put in there. But let me see if I can stop my share and bring us to a screen where we can see what folks are saying about how they felt during that PR moment or during that favorite performance.
Nicole, I'm really slow and misspelled everything in that. What were the numbers or the last part? Because it was the name, right?
I got you. It is POLLEV.com/Nicole, NICOLE, DEFERR 968. Thank you. Thanks, Nellie. It's in the chat there. Ooh, let me get this shared. Okay, you should be able to see folks' answers starting to come in, and the bigger the answer, the larger the font, the more people are endorsing that particular emotion. So you can see we've got a lot of joy, pride, accomplished, excitement, nerves, exhaustion, confidence. Yep. Pure relief, love that. Yep, motivated. Excitement, pride, joy, really taking a lead there. Very cool. And it looks like we might be winding down a little bit there, but what we're really exemplifying is that emotion plays a huge role in our sport. And that's really what IZOV focuses on. It focuses on the relationship between emotion and performance. And interestingly, one of the bigger emotions that we're seeing is excitement. And we're going to come back to that in a second. Let me just stop my share of this screen and toggle back to the PowerPoint. Let's see here. Does anyone, while I'm toggling here, does anybody have initial thoughts about seeing what those emotions were that came up for folks?
Seemed like they were mostly positive.
Agreed, right? Positive emotion associated with the greatest performance or the most memorable or the highest PR that set. Yep. Seems noteworthy, right? Okay. Great. So let's dig into this a little bit more. So a part of what we just really went over was a person's individual IZOV. Now there's more to it than just identifying what the emotions are, but that's the crux of it again, because IZOV really talks about the relationship between emotion and sport. So basically how we feel influences how we perform. And for us to know that as personnel who work with athletes, it's really important for us to be aware of how our athletes need to feel in order to perform at their peak. Now, IZOV is a concept that was originated by a man named Yuri Hannon. I think back in the 90s or something like that. I'm misremembering. But he states that IZOV is an emotional state that a person is in when they're at their peak performance or they're at their optimal arousal state. And as you can see here, this is a chart that exemplifies optimal arousal state. Folks really need to have a balance between having enough arousal and having too much arousal. So if there's too much, it's really tough to focus. It's really tough to say, in the zone or in a flow state when engaging on the field or on the court or in the pool. And then when there's not enough, the motivation to perform well tends not to be quite as high or where it would normally be. So everybody's kind of got this sweet spot for themselves in the middle of the U curve here. Now, a part of what helps us find that sweet spot goes back to one of the emotions that y'all highlighted, which was excitement. So excitement is a form of anxiety. It's a positive form of anxiety. And well, why would that be? When we think about when we're excited, our heart's probably beating pretty fast. Our thoughts are probably going a little quicker than what they normally would. Our breathing rate is probably a bit more maximized to engage with whatever activity it is that we're working on, whether it's a game or a lift or a practice or something like that. So excitement really reflects an anxiety state, and that anxiety state is what allows somebody to maintain their eyes off. Now, here's the fun part. Everybody has a different IZOV. So one person's level of excitement might look completely different than the next person. So somebody who has a low level IZOV is going to be performing and they're going to seem a little bit more chill. Somebody who is high is going to seem really amped up, really keyed in, and they need that level of ampage, so to speak, in order to perform at their best. And then of course we have folks in the middle. And to think about examples of these, we can think about LeBron as sometimes a lower level IZOV athlete. You'll catch him on the court sometimes meditating after a chaotic play. And on the high end, you might imagine somebody like a TJ Watt, who if you catch before the beginning of any Steelers game, he's leading a chant with his teammates kind of surrounding him. Everybody's getting amped up and excited to perform. So what are some of the characteristics of an emotion and performance relationship that we need to have in our minds so that if this is something we want to foster more overtly with our athletes, that we need to think about? Like, what are those characteristics that would be important for us to know? So the first of that is that emotions develop as the result of the degree to which the performer believes they can achieve the goal. So in other words, if a person believes they can achieve something, it's more likely that they're going to maintain a healthy, effective IZOV. If it's somebody who is under or overshooting their goal achievement, it's going to be tougher for them to get into their IZOV. So something important to keep in mind. Repeated situational emotional experiences lead to emotional patterns, AKA we are creatures of habit. So if we experience repeated situations like a repeated practice style or repeated circumstances in a game or repeated circumstances in, insert performance here, whatever emotion we have during that time, we associate with that performance. So if it's a positive emotion, we're more likely to associate it with whatever that performance was, and same for a negative emotion. Emotional patterns are specific to task setting and the individual. So again, IZOV is something that is very much a tailor-made experience for individuals. And it's going to look different based on the task. If you think about how you performed when you were in school, that was probably different to some degree compared to how you performed on the field or on the court. So when we're talking about performance eyes of, we want to think about how do we maximize it for performance. Additionally, emotion and performance create a feedback loop. So kind of going back to our first couple of characteristics, this highlights it even more, that positive performance creates a positive feedback loop, negative performance creates a negative feedback loop, and they feed each other. It's bidirectional. The balance of optimal and detrimental emotions can impact performance. So this one is, it's kind of like a, well, yeah, of course, you know, if we have too many negative emotions, it's probably going to lead to a negative performance. But if we have more of a balance with having negative emotions and optimal emotions, then that's going to lead more likely to a performance that the person wants to have success. So something to keep a lookout for is that balance. I don't think I've ever worked with an elite athlete who doesn't have some level of critical self-talk for their motivational fuel, right? And what do we know? That critical self-talk fuels emotions. What we want to make sure to do is reinforce with athletes who have that is we don't want to change your motivational fuel. Like, we understand that critic can be helpful to a certain degree, and at the same time, we want it to work effectively for you. So that balance is key. And emotions build a home on the brain's land. What I mean by that is the relationship that we have with our emotions becomes one that we can't really forget, or as it states here, it becomes meta, because what do? We remember what we go through. We reflect intentionally on what we go through. And in some cases, if it's a negative situation, we might ruminate on what we go through. And when that happens, it builds, it sort of takes a stake in the brain. And if it does it in a detrimental way, then there's some work to be done to unpack, unentangle, so that the way that we think about what we're doing to elicit the emotional reaction that we want to have a positive performance can get back to that point of positive performance or successful performance. So the main takeaway points from this particular section, though, because I know there's a lot there, but these are kind of like the main 4 points to remember. Anxiety or excitement is key. Everyone's got to have a little bit of it, again, whether it's at that low, moderate, or high level, in order to maintain their eyes off. That self-belief is critical to success. This is something tailor-made, so one athlete's eyes off is probably going to look fairly different from the person standing next to them. And cognitive concrete is very real. How we think dictates how we feel, and because situations, especially if they're repeated, if they occur in a certain way that's detrimental, that creates and takes space in the brain, and we want to make sure to avoid that happening as much as possible. So those are sort of the main takeaway points of the characteristics here. So what we're going to do next is segue into, okay, well, how does this parlay with mental health, right? There's something called the stress diathesis, and the stress diathesis basically speaks to vulnerability that a person has to developing a clinical mental health disorder or emotional dysregulation or burnout. And it's based on different things like genetics, environment, social factors. And the stress diathesis occurs when the stress that a person is experiencing is disproportional to them being able to manage it. So in other words, when the stress becomes too overwhelming, and that overwhelming level of stress depends on the person and depends on all of the factors that are listed there. But I bring this up to highlight that this has been a particularly stressful, going on over a year now because of the pandemic. I would also say that because of the racial injustices that we're seeing our colleagues, our loved ones, our coworkers of color go through this year, that causes stress for us to find ways to be able to support and be effective allies for them. But then also they have to go through living with the injustice that's occurring every day, and that creates stress and heaviness on the heart. And then pausing sports initially last year, we know it was necessary. It was necessary to figure out, well, okay, what do we do? How do we keep everybody safe? And then what's our plan for getting back to sport? But all of these things created higher levels of stress than I think any of us have had to deal with in the past. And it's created higher levels of clinical mental health concern, burnout, and emotional dysregulation for folks. So a lot of what I do with my students is working on rebalancing so that a person can feel more emotionally regulated, a person can feel emotionally well in the way that they want to, and to rebalance that level of burnout so that they can get back to their life in the way that they normally would attend to. Now, it goes without saying that this messes with eyes off, right? When a person is unable to tend to life because of an insurmountable amount of stress, they're probably not performing very well. It makes sense, and we understand it. So what we're going to get into in a little bit here is how do we maximize in light of having to deal with the year that we've all been dealing with. So what we'll first talk about, and jumping more into our practical implications for all of this, is helping athletes find their eyes off from more of a cultural sense. So a lot of you might already have this within the culture of how you work with your athletes, but here are just 3 main takeaway points. Normalizing talking about emotions as they relate to performance can be critical, because what that means is that when an athlete is comfortable sharing about how they're doing during a performance, they're more likely to be able to move and shift their emotional experience if they're experiencing an effective ones. I think what happens a lot of the times is there is a stigma around sharing emotions when it comes to the world of sport. We know it's there, we know it's alive and well, and that's okay. I think that if we can break that stigma through normalizing emotional expression, then all it does is help our athletes be more successful than they already are. Encouraging effective self-talk is the next one. So this is what we were talking about a little bit ago, where every elite athlete has a version of a critical inner voice, right? That's helping them stay motivated, stay fueled to perform, and hold themselves to the standard they need to be the elite athlete that they are. However, there is a difference between critical and effective. And I think helping folks lean more towards effective self-talk can be of critical importance. Additionally, making sure that athletes are staying sustainable within their goal achievement, right? Like, we always want to promote growth. We always want to promote getting better and reaching the goals that they have for themselves at the end of the days. However, if we have an athlete who's constantly underselling their goals or constantly overselling their goals, those are the athletes that tend to get themselves in a little bit of trouble mentally, because they have to be able to achieve in order to build that confidence. And if they're not achieving their goals, it's really hard to get into their eyes off. So drilling down a little bit further, we're kind of going from culture at large to bringing it down to, like, okay, if I have a group of athletes in front of me, what can I do to help foster an eyes-off based environment? Well, you might already do some of this with your athletes. I love to talk with my athletes about doing mental warm-ups. I'll encourage them to do that, like, first thing when they wake up in the morning, or like last thing that they do as they're winding down for the night, but basically a way to implement the different techniques and things that we talk about into their daily routine. So a way that can happen in their sporting life is to think about, let's do a mental warm-up before practice or before lift. In the same way we stretch out our muscles, we got to stretch our mind. So these are just prompts that anyone could ask the group of athletes that they're working with. What emotions do you need in order to have success today? Then you would ask them to take a minute to close their eyes and breathe deeply to help let go of any emotions that they need to put away that aren't helpful for that moment. And then I'd often encourage asking them to imagine themselves picking up the emotion that they need, literally using their imagery skill to imagine picking up that excitement, that pride, that sense of accomplishment, so that they can use that and embody those emotions for whatever the task is that they're up against. Again, whether it's a lift or practice or a game. And it's also important to validate that they can pick up the unhelpful emotions later. We never want to dismiss an emotional experience, because we literally can't fake emotions. Folks can lie about how they're feeling, right? Like, they can say they're happy when they're feeling sad internally. But when you think about, if you've ever felt something, there's no way for you to, like, misgenerate that or not authentically feel what you feel. Third step is you tell them, give yourself permission to own the emotions you need for today. And then I find that sentiment of giving permission to the self really allows folks to embody what they need to feel to go forth again with whatever task is present. And drilling down even further, say you don't have a group, say you have an individual athlete approach you about wanting to work on their eyes off. I like to use this tactic and come from the frame of maintaining eyes off with mental game film. So I often tell my athletes, tell me a story of the greatest success you've had in sport, kind of like we did earlier today, right? But I want you to tell me the story as if we were watching it play out on game film. I'll ask them what 3 emotions were present for them, or 3 to 5 if they had a couple of extra that stand out to them. I'll ask them, why did those emotions contribute to their success, why they felt that happened. And then I'll ask them to rate how intensely they felt each emotion. That's where you'll get a gauge for what level of eyes off the person needs to be at, whether it's low, moderate, or high. They're going to tell you through that rating. Then I ask them to implement it further. I'll say, now imagine we're watching a new film, and this is the one where this is the film of you achieving the current goal that you're trying to work on, the current goal you're trying to smash, right? Talk me through that and how it looks, and incorporate those emotions into the film. I'll also oftentimes talk with them about, let's go through a scenario where something goes wrong. This allows them to mentally prepare for, go wrong situations, but then also how to recover from them. And the recovery is often easier because they're picturing themselves do it in this effective emotional state. So those are some of the practical tips and tricks that you can take away to use with any of your athletes, again, from sort of that cultural level, group level, individual level. And rehearsal is key. Again, finding a way to encourage your athletes to incorporate using this particular mental technique into their daily routine, whether it's a pre-performance routine, a part of their wake-up routine in the morning, or a part of their wind-down routine at night, that is going to make it effective. We grow our mental skills the same way we grow our muscles. We got to push them and work on them to get to the strength that we want them to be at. Now, there is the chance that you could be helping an eyes-off or helping an athlete establish and work on their eyes-off, but it's not panning out. They're not able to get into their eyes-off in a way that seems reasonable. And that's probably your sign that more intervention needs to happen for that person. They might be dealing with something like a clinical mental health concern, or like some pretty serious burnout. And that's what's going to need to be addressed in order for them to get back to that peak performance state and be able to use eyes-off in the way that it can be. So these are just some signs to be aware of in case you might need to make that call for more intervention. So if the athlete is consistently performing outside of what's normal for them, if your gut is telling you that they just seem kind of off or not themselves, I always encourage people, trust your gut. And if you think someone's having a bad time, ask them how they're doing. And if they decide not to tell you, that's okay. I think what you've done there, though, is open the door and let the person know that they see you, or that you see them, that you're worried about them, and that they can approach you if there would be a time later that they would want to tell you how they're doing for real. A big one is other athletes would probably approach you with worries or concerns with how the athlete in question is doing. They might, there are boots on the ground for being able to check in on each other. And I take really seriously when I hear athletes have concern about their teammates or their friends. You might notice them withdraw from social groups. They might be late to practice consistently when that's not normal for them. You also might notice things like weight loss or weight gain that's not a part of their performance plan. That's a big indicator that they've slipped into a space where they're not able to take care of themselves in the way that they need to be. And then you probably would notice a difference in emotional reaction to things. So things like shorter temper, less patience. They might be easy to set off. So when you're walking into the locker room and you say to someone like, hey, you had a real good practice today, and they're like, hey, don't talk to me, I don't have time for that right now. It's kind of like, ooh, okay, something might be up. So signs and things to just kind of have an eye out for if you're noticing that you're trying to help an athlete get into eyes-off and it's not going well. There might be something else going on for them. So what if you're not sure? I always welcome consultation. The easiest way to get a hold of me is by email. There's my email there, and I'm always happy to meet with folks on the fly, or if schedules don't pan out, I'm always happy to schedule a consultation meeting. That athlete doesn't have to be seen at CAPS to do a consultation with me. They can be, of course, but doesn't have to be. In addition to that, if you're wanting to learn more about CAPS resources, we have things like individual therapy, group therapy, psychiatric medication prescribing. We can help connect folks to longer-term levels or longer-term care, or to higher levels of care if that's needed. Basically, if you've ever got a question about an athlete and how their mental health is, and you want to know kind of like more about what to do, or just kind of like have a space to process thoughts out, please, please, please hit me up. I'm always happy to do that. Okay. So that brings to the end of my information here. I'm gonna stop share. and bring us all back together. But thank you guys so much for your time and attention today. And Nellie, again, thank you so much for having me and to talk about this topic.
Absolutely. Nicole, thank you so much. I will say we're at the 30-minute mark. So as we always do, if anybody needs to pop off, you certainly can. If you want to stick around for some questions, we will take some time to do that. Thank you, everybody that has come and needs to pop off. And thank you, Nicole. Does anyone have any questions or anything we'd like to dig into a little bit more?
Nicole, I have a question here. Sam Slobonov, are you hearing me?
I can hear you. Hi.
All right, Nicole, that wonderful presentation. Thank you very much for updating my knowledge, the former knowledge. Question that Hunting theory, Urey Hunting theory of the optimal zone performance individualized, been developed back in 1975, so if I remember, and then confirmed by that Gershon Tittenbaum and many other people in all over the world. Terry Orlick was on the same page. I wonder that since that time, is any research, particularly in sports psychology, in confirmation or opposing the zone of optimal performance? Because was concerned about this individualized and sport individual approach. So what does a honey for one athlete in the track and field will be poison for a football player and vice versa? So the question is that is any scientific evidence based upon that what is known for the last 20 years, the theory of the zone of optimal performance was effective, implementing in a clinical practice?
Yeah, no, that's an excellent question. And I think that if I'm remembering correctly, I think this has been a concept studied like over 200 times in the research that I'm thinking about now. But I think what's come out in the research is something really important that incorporates the stress diathesis that we were talking about a little bit earlier. It was kind of originally thought that a person would need to have these certain predispositions in order to obtain their IZOV, or to sort of predict, if you will, the likelihood that someone would incur burnout or incur dysregulation or incur clinical mental health disorder. But what they find out, if I'm remembering correctly, is that that's bidirectional. So what that means is that a person's IZOV can influence their stress diathesis, and that a person's, and then vice versa, a person's stress diathesis can influence their IZOV. So in other words, if a person is feeling depressed, that's going to influence their individual zone of optimal functioning. And then if a person is performing, say, with low IZOV functionality, that could influence the onset of depression for them. So that's sort of the clinical component that I've seen that I think is pretty interesting. I think it speaks to the importance of just making sure that mentally folks are doing okay, feeling okay. Yeah, that I think is a really great question. And it's nice to meet you. I don't think we've met before.
Sure, Nicole. That I was a sports psychologist for the Soviet Union national team as a head coach. And then I work with Terry Orlick, and I actually my chapter in a recent textbook and a handbook on sports psychology, was recently published by Gershon. And then and I'm director of sports concussion program at Penn State here.
Very cool. It's so good to meet you.
Thank you.
Nicole, I wasn't on for the first 10 minutes or so. I was wondering if you'd be able to share your slide presentation just as kind of a reference point for us.
Yeah, for sure.
After the presentation, that would be very, very helpful.
Absolutely. I'll make sure to get it. Nellie, is it okay if I get it to you and then it can kind of get dispersed out to folks?
Yes, ma'am. Absolutely.
Cool.
Thank you very much.
Yeah, of course.
I have a quick question. Do you think a person's IZOV is pretty consistent, or can it change like game to game, day to day, based on what they're currently going through or how they feel about this game or whatever it is?
100%. Yeah, I think yes is the answer to that. I think that if a person's really going through it, say they've recently experienced a trauma or the loss of a loved one, or Maybe this is their first game back from an injury or something like that. I think that that's going to dictate how they approach their eyes off. So what they're going to need to help in a situation like that is kind of ripping the Band-Aid, so to speak, kind of jumping in, seeing how they perform, and then understanding for themselves where they were at. And if they were in an effective space, then that triggers the individual evaluation of like, okay, what was going on for you emotionally? How highly were you feeling the emotion you were feeling? Why do you think those were there? And let's see if we can get you back to a point where we can imagine yourself in a more emotionally effective place. But yeah, things like outside circumstances, I could imagine high pressure games, like if we're talking about like a normal competition or normal regular season game compared to like an NCAA tournament game might change out a little bit. I think the most important piece is just honest, truthful evaluation of where an athlete is at, being comfortable confronting any negative or ineffective emotions that might be there, and then being flexible, but also being skilled at managing their emotional response, competition to competition.
Great, thank you.
Yeah, for sure. I don't think we've met either, Adam. It's nice to meet you.
Yes, you too. Absolutely. I work in the applied health and performance science department as well as an assistant.
Cool.
Nicole, I should have introduced myself. I'm Tim Murphy, I'm coach for men's and women's swimming and diving.
Oh, Tim, it's so nice to meet you.
Appreciate it. I've enjoyed your chat here.
Thank you.
I appreciate your presentation. I'm in education. I'm a faculty in athlete training. My primary role is to assign athlete training students to clinical sites, kind of things. And so I don't really deal with student athletes or anything like that, but I was an athlete trainer previously. How you work with, obviously the great system here at the Penn State, Dr. Olson and you, how you can work with, not necessarily for the performance, but also that, in order to perform, some things going on in the life and, some stress and depression, but also depression, stress, and anxiety come from sports and participation. So how you can work with both of you to what is the factors that affect the psychological, the depression, whatever, but how you can work with that to help the student athlete be healthy mentally, but also how you help to perform, how that, communication is to do that work at the Penn State.
Mm-hmm. I really appreciate that question. And it's good to meet you too. Yeah, Carl and I actually work pretty collaboratively. I think one of the great things about both of our systems is that I came in to this role in August of this past year, and it had already been set up with a strong strategic partner relationship. And what I think I've come to really appreciate about how we work together is that we both understand that there's a lot of overlap in what we do, and we're able to find ways to make sure that if there is a difference are they presenting with more of a performance-based concern, to help get them routed to Carl and Adriana, or if they're experiencing more of a clinical concern, to help get them routed to me or to CAPS at large. I think communication is a big part of that. And I think a lot of the times we troubleshoot on the fly and with particular circumstances that come up. But yeah, I think that being able to just talk with each other and let each other know what we need for particular situations is kind of been what I found to help that out.
Thank you.
Hi, Nicole. I have a question. Do you think it's important for coaches to go through the process of just sort of determining where they sit in terms of eyes off, and sort of what sort of stimulation they need to be an effective coach? And then as a follow-up to that, should they communicate that to their athletes, and so that everybody sort of is on the same page and they know, what to expect from their coach on game day and things like that?
Yeah, I think that that's a really smart takeaway, actually, that this is something that we can all use, whether you're a coach, a trainer, sport administrator, director of ops, Diaz, I see you. these are concepts that, yeah, we can absolutely apply to ourselves. So for practices, a coach might need to, be in a zone that's of one particular level. And then for a competition, they might need to be in a zone that's at a different level. And I'm a big fan of modeling how we are, because what do we know about people in general? The folks that we sort of oversee or have some level of like authority over, or that are under us if there's a hierarchy involved, they tend not to take care of themselves based on how we tell them to take care of themselves. They more so tend to take care of themselves based on how they see us take care of ourselves. So modeling something like eyes off and being explicit about it, I think could be a really valuable tool. I think what that does is a part of the emotion normalization process that we were speaking to earlier, which again, if that's something that feels like it would be an important part of your team's experience, then yeah, I say go for it. It's also nice to meet you.
Thank you. Nice to meet you. I also work in performance science with Nellie and Adam and John.
Very cool.
I have another question. We try to help the student athletes and try to help perform the kind of things, but we ourselves need to be, healthy enough mentally, get going. And sometimes, based upon circumstances, sometimes we get beat up by coach or administrators or whatever. But then I'm not asking your help, but just how can go with this to, we keep going and we be excited and, keep going, but just sometimes tough to go through that, emotion and need to treat but how does ICA have a system that perhaps, supporting cast can ask you to go with that? I think it's very important to collaborate. We are helping and supporting the student athletes. That's we get paid to do that per se, but also that we need to be like, at the top of the game to actually help that. But sometimes we can't because of some reason. And so I kind of feel like, yes, I can ask the doctor to do this, but also because it's a part of that team. So I'm just curious how ICA can help, these supporting cast to actually be on the top of the game, to ready for the NCAA or whatever. That's great, but just may not be ready mentally. And if, so I'm just curious what you feel about that.
Yeah, no, I think that you raise an extremely important point, and what you're saying is so valid. When I think about that point of modeling how we take care of ourselves and how that trickles down to the athletes, that's exactly it, right? There are a couple of different ways that CAPS can be helpful with that. So something that we do is lead different de-stressing or decompression activities. So if there's a particular group of staff or personnel that you want to get together, let me know. And we can do an effective, something like a muscle relaxation strategy, or teach grounding, or any other coping skills that would be helpful to take away, something tangible that folks can use. More than happy to do something like that. The other thing is, if a person would be interested in pursuing something like therapy for themselves, I have a list of folks in the community, a list of therapists in the area who are great to work with, who more specialize working with non-students. And there's also information for, brain glitch, for the EAP on there as well through health insurance. And that's something that I will share with anybody who wants it. So all a person would need to do is email me, and all they need to say is, hey, send me that referral list. I ask no questions. What person can use it for themselves, a person could use it for a colleague or a friend that they're worried about. But basically, we can kind of go in at two levels. We can do sort of group coping skill teaching intervention, but then I can also get more individual referrals if that would feel needed. Yeah, I think you raise a really important point, though. We got to take care of ourselves.
Cole, I'm going to jump in for just a second to add, in addition to that, what a lot of people outside of ICA don't have visibility on is that in our performance psychology department, Adriana and I actually prioritize our coaches first. we tier the services. So we're here for our coaches first, then entire teams, then individuals, with the notion being we have to take care of the people that are taking care of our athletes. As a branch off of that, we have also done sessions for athletic trainers, strength coaches, administrators, the business side, whatever, so we can talk about performance education, because as Nicole mentioned, there's a huge overlap. Oftentimes we're teaching the same skills, possibly through a different dialect because of a different area of interest, but the performance of our employees is a vital component of what we focus on, if they ask for it.
Thank you.
I always jump in here. I'll jump off yours, Carl, too. If you know, I'm really biased toward looking at how teachers develop, and there's a lot of information out and research in the past that really shows that teacher performance is a direct correlate of athlete, or it would be student performance. So the better product I as a teacher put in front of my students, the more learning that they're going to take. So you take that to the field. The field is the classroom for our athletes. The weight room is the classroom for our athletes. So the better product I can put on in the classroom as a coach, you know, the better or more development they're going to have. So we definitely have to prioritize health, wellness, and our product that we create. Love that.
Nicole, Don Friday from down at Penn State Harrisburg. Thank you so much. And Josh, thank you for the email. It's a wonderful resource. My question would be, in a game, throughout a game, a student athlete's eyes off could change. And any coping techniques late in the game, you know, I coach basketball. So, you know, it gets critical juncture where maybe, you know, it's a game of runs and you can get caught into that emotion. Any type of like coping mechanisms as coaches we can help our student athletes with when 2 or 3 negative things happen in a row, and then trying to distance that and move on past that.
Yeah, it's good to meet you. I think you raise an important point here. Eyes off is something that takes constant balance to stay within. But once a person is in it, it's easy to stay within it. However, when they get knocked out, it's harder to get back in. So a lot of the times what I'll work with folks on is like an acknowledgement phrase of like, let yourself acknowledge what you're feeling in this moment and then put it away. You can come back to it later. So that sentiment of like, you don't have to get rid of it. You can talk about it to yourself later. I think is really powerful. I think sometimes folks feel like they have, when they are trying to like move past an emotion, that means that they're not allowed to experience it. So I think giving them permission to kind of put it away for later can be really helpful. But I'll have them come up with a phrase, something like, I notice I'm feeling a little like ticked off right now. And that's their sign that they need to rebalance and get back to eyes off. Or something like a recovery phrase, something like focus, go, when they're acknowledging themselves, getting into like an emotional headspace where that critical inner critic is really starting to gain some volume and gain some traction. So I think little cue phrases like that can be really helpful. If it's not working, then that would speak to, I think, needing to take some time outside of the game to practice the imagery for holding on to those positive emotions or the emotions that they need. And if that's not working, then there's another sign that there might be something larger going on for them that's preventing them from being able to move forward and move past. But yeah, game time is definitely the time where this plays a huge role, a huge role.
Thank you.
Mm-hmm.
Does anyone have anything additional? All right, well, Nicole, thank you so much for the time. Thank everybody for joining us today. The last thing I will send out is a reminder that May 25th and 26th from 1 p.m. to 4 p.m. each day, our sports performance leadership team at Penn State University Park campus will be hosting our performance summit. It is all virtual on Zoom. Have sent out the registration link last Friday to all the campuses across the Commonwealth. Would encourage you to share it with your staff. I will say that it does require registration. So all you got to do is click on the registration link and sign up, and then you'll get the Zoom link. If you have any questions pertaining to that, please reach out to one of us on the crew. email me directly, whatever you need. And we're just trying to promote that. But May 25th and 26th in the afternoon on both days. So,
Josh, quick question. Will
yes, sir.
Will you be recording that? Will we have access to go back in case we weren't able to make it or stay the whole couple hours?
Yes, sir. We will record and document everything, and then we can distribute it to anybody that may miss or want to go back. We'll have it all recorded. Yes, sir.
Much appreciated. Thank you.
Yes, sir. Okay. Well, everybody have a great weekend. Or I guess it's the middle of the week here, but have a great week, and thank you for joining us.
Nelly and Nicole, can you stay on for just a minute?
Yes, sir. Absolutely. Thank you, guys. Bye-bye.